Hello, I'm Dr. Semanti Bose, a registered gynecologist, and today I want to talk to you about PCOS or PCOD, also known as Polycystic Ovarian Syndrome. So let's dive in. PCOS is a disease that is characterized by anovulation or irregular menstrual cycles. It is also characterized by an increase in the male hormone, that is androgens, in a female body, and a polycystic appearance of ovaries on an ultrasound. Hence the term polycystic ovarian disease. To understand the pathology of PCOS, we must first understand what a normal menstrual cycle looks like. For a woman who has a 30-day cycle, the first 15 days is called the follicular phase. This is the time when, under the influence of certain hormones, the uterine lining becomes thicker and thicker, and then the woman ovulates. After ovulation, the next 15 days, the same uterine lining undergoes certain changes. These changes ultimately lead to the uterine lining breaking off at the end of the month, which is known as normal menstruation. These changes are called decidualization, and this can occur only once ovulation has taken place. In women who have PCOS, there is an underlying insulin resistance. This insulin resistance could be because of lifestyle factors, could be because of genetic factors, or even environmental exposures. Because of this insulin resistance, there is an imbalance of the hormones that regulate the menstrual cycle. So what happens is that the follicular phase is prolonged for an indefinite period of time. So, in return, the uterine lining gets thicker and thicker and thicker, but ovulation does not take place. Since ovulation hasn't taken place, the decidualization of the uterine lining does not occur. And then ultimately, the uterine lining becomes so thick that it starts breaking off in parts and chunks from the uterus. That's why many women who have PCOS may have cycles which consist of irregular spotting in the beginning, followed by heavy bleeding, which does not stop and is uncontrollable without medication. The imbalance of hormones in PCOS also causes women to have an increased amount of male androgens or male hormones in the body. This results in the symptoms of excessive facial hair and acne on the face for many women with PCOS. The second part is weight gain, which is uncontrolled and easy. This mainly is because of the insulin resistance, which results in fat deposition all around the body. Your doctor will diagnose PCOS based on the presence of two of the three criteria. The first is irregular cycles. The second is either your lab reports or your clinical features showing excessive male hormones. And the third is a polycystic appearance of ovaries on an ultrasound. So, keep in mind that only two of the three criteria are required to diagnose PCOS. A woman who has polycystic ovaries on an ultrasound but does not have any of the other symptoms does not necessarily have PCOS. This is something to keep in mind. Apart from the short-term complications which I have already explained, PCOS can also have long-term complications on the female body. These include obesity, hypertension, diabetes, infertility, and in some rare cases, it can even lead to uterine cancer. Living with PCOS can be mentally and emotionally challenging. There's a strong link between PCOS and mental health conditions like anxiety, depression, and low self-esteem. Dealing with the weight gain, hormonal imbalances, and fertility concerns can take a toll on your mental well-being. That's why it's important to focus not just on the physical health, but also on emotional and mental support that you may need during your treatment. For women who've been newly diagnosed with PCOS or those who are living with PCOS, you don't need to fear. Most of the time, the treatment consists of a combination of a good healthy diet and an exercise regimen. Medication will be provided to you only if required in some cases. The diet should be made in accordance with a dietitian and should provide you a balanced meal along with a good healthy protein dose. The exercise regimen that is recommended by RCOG is around 30 to 45 minutes of moderate intensity exercise at least 5 times a week for any woman living with PCOS. This will mainly address the insulin resistance that is prevalent in the body. You should contact a healthcare professional to understand whether starting medications would be the right step for you if you are living with PCOS. Early detection of PCOS is key to managing the condition and preventing long-term complications. Regular checkups allow us to monitor your hormone levels, menstrual cycle, and overall health. If you notice irregular periods, excessive hair growth, or sudden weight changes, don't hesitate to consult a healthcare provider. The earlier we identify PCOS, the sooner we can develop a management plan tailored to your needs. In conclusion, PCOS is a complex condition, but with awareness, early intervention, and proper care, it can be managed. If you think you may have PCOS or have been recently diagnosed, remember that taking control of your health is the first step towards feeling better. Thank you for watching. If you have any questions, feel free to reach out to me or to any healthcare provider near you. Stay healthy.